Knowledge of what is possible is the beginning of happiness. Quoted by George Santayana. Hello, myself Sakshi Dhoran from CPWWORLD. Today we are at Mannsparsh Neuropsychiatric Clinic, which is located in Vijaynagar, Kalyan EAST. Here we are going to meet Dr. Bhushan Patil, who is a well-known consultant psychiatrist. So let's go inside and meet him.
To be called as a challenged handicapped child. Now we have changed the terminology to special child because we don't want that stigma attached to it. So when I talk about the special children, actually it is the broad category. There are very finer categories under the special children's, but special children's are the children's, if I have to talk in short, they are the ones who are developmentally disadvantaged. Means their development, their usual, what we call it as, there is something called as a developmental age and there is something called as a chronological age. So for example, if the child is chronologically by birth date, if he is 5-year-old, but his development is that of the 3-year-old. So there is a difference in the development. So child is lagging by 2 years. So that means that child is not developing the way it should be developed. And these are the children which comes under the category of special children. So that is a one way, broadly, how you can identify the special children.
So are there any types of?
Yeah. So when we talk about special children, actually if I go about the DSM-5, which is the diagnostic manual for us, so we classify them under various categories. So there is something called as a neurodevelopmental disorder. So there is a one classification which says what we call as a intellectually challenged. Okay, the intellectually specially able children. That is one category. Second is ADHD, those who are having attention deficit hyperactive disorder. Then there is a third category called as autism spectrum disorders. So these are the main three categories under which we classify the special children. And there are children who have the difficulties especially related to their academics. They have been classified under the learning disabilities. So these are the broad categories under which we classify these specially able children. So that's how we classify.
Okay. So आप जब भी कंसल्ट करते हो उनको तो उनको भी काउंसलिंग की उतनी ज़रूरत होती है?
Yes. See, when we talk about the special children, let me tell you, when there is a one child who is considered to be a special child having some developmental problem, it's not only the child who requires a counseling, it's the entire family which requires the counseling. Because child से ज़्यादा तो पूरी फैमिली ज़्यादा परेशान रहती है. क्योंकि चाइल्ड को तो कुछ समझता नहीं उसके साथ क्या चल रहा है. वो तो अपना जो चाइल्डहुड है जिस तरह वो एंजॉय कर सकता है वो कर रहा है. वो खेल रहा है, वो यहाँ वहाँ दौड़ रहा है, he is playing with his toys. So he doesn't know or she doesn't know whether he or she is having some problem. It's the parents who identifies it and then they come to the specialist for the consultation. And that is a time, actually I'll tell you, in child and adolescent psychiatry it is more the parents and the family which requires counseling than the child. Because child is young, so you cannot counsel the younger children. But yes, you require a hell lot of work when it comes to the parents and family, because इतनी ज़्यादा anxiety और apprehension होता है कि why my child is like this, is my child going to be better or is it going to be the lifelong disability, so many questions and number of questions, and answering those questions as a consultants also at one go it becomes difficult for us. So yes, the counseling is required, but it is more for the parents and the family rather than the child person.
तो अभी इंडिया में उसके रिगार्डिंग क्या सिनेरियो है?
Okay, so if we are talking about especially our country and specifically about the child and adolescent psychiatry, yeah, I can say India is progressing as we are progressing in other fields. We are progressing in this field also, but still there is a need for awareness, because many of the time the parents or the family tend to delay the treatment because they feel it is normal for that age. So for example, if suppose some child is not able to speak up to the age of 3 years, so usually society उनको बोलती है या फिर family members बोलते हैं अरे धीरे धीरे सीख जाएगा, but they are not understanding that the child has missed the very important early period of development जहाँ पे intervention हो सकता था. In child and adolescent, we specifically target about early interventions. We keep on saying early intervention helps, early intervention helps, and that's how we even make the awareness in the schools, in the nurseries, in the senior KGs, junior KGs, right up to the primary schools. Because many of time the teachers are not aware, or they are aware, they tend to neglect, they don't interact with the parents, they sometimes find punishment is the only option to deal with such children. So they don't understand that if some child is having difficulty, at least find out the reason behind it. If I compare it to the developed countries, Western countries, they are far ahead of us. But currently, I think the government of India has taken a lot of initiative under Sarva Shiksha Abhiyan. Because of that one particular Abhiyan, we are able to help out those children who are having the learning disabilities. So under Sarva Shiksha Abhiyan, there are a lot of what you can say facilities or concessions are given for those children. Then there is something called as Swavalamban Yojana, which is run by the Maharashtra government, which is especially for the children who are having some kind of difficulties, and especially the Person with Disability Act, something called as the PWD Act, which is I am very happy that it is strongly getting enforced by government, not only by central government but even by the state government. So because of that, what's happening is under this Swavalamban Yojana, the people who are intellectually challenged are getting help. They are getting certain things they can do in their life and they can work on it, and independently they can live their lives. So yes, scenario is changing in India. We are moving one step ahead, and I think it is very much needed that more and more early intervention should be done so that we can help these specially able children.
Okay, that's really great. But while treating them, do you face any difficulty?
Yeah. So let me talk about the difficulties which are ground level difficulties which we have. Especially I am talking about our country. because we are aware of the fact that there is a limited resources. See, I'm not talking in terms about the population which we have. We have a huge population to serve. So if I had to talk about the number of psychiatrists in entire India treating, the last data which we have is a 4,000 psychiatrists for the population of, you know what is our current population. So if you go by the ratio, you will understand that one psychiatrist has to at least consult 2,50,000 population, general population. Means the एक psychiatrist जिसको 2.5 लाख लोगों के mental health का ख्याल रखना है. So you just see what is the ratio. So it's becoming very difficult. That is the first, because I feel there is a need for more trained professionals which are required. But currently what is happening in our country, usually it is the normal people usually do the graduations and post graduation. So they do either MD or DPM and they earn this degree and they practice. But there are also in advanced specializations, like we have fellowships in child and adolescent psychiatry, we have doctorate in child and adolescent psychiatry, which are the additional qualification person can take for them to have a proper knowledge and the skills. So that is the first difficulties that we have as far as this particular field is concerned. The second important thing is about difficulty is the child and adolescent psychiatry. It is a multidisciplinary team efforts. It is not the only psychiatrist who plays the role in the treatment. We require a team of psychiatrist, psychologist, pediatrician, occupational therapist, speech therapist, remedial educator, and also a physiotherapist. So if I have to run a child and adolescent clinic, I have to have this entire team. And see, big cities, no problem. You immediately get people. But the small towns and the villages, you can just imagine where getting one primary healthcare center at a village level is so difficult. Right. There is no question of child and adolescent clinic there. So actually the problem over here is, because child and adolescent psychiatry is a multidisciplinary team efforts, we need to have that multidisciplinary team. And that is a second challenge which we face day in and day out, even in the cities, I'm telling you. Because getting those professionals, building that team and all these things becomes sometimes difficult. The third challenge which we face is about, as I already spoke to you, about the parents' emotions. So sometimes the parents' emotions are so overwhelming. Either the parents criticize themselves or their fate or उनका नसीब और इसको सब बोल के they start criticizing themselves. Later on they start criticizing their child also, because they feel why such child is born to me. So the parents' emotions sometimes are so hostile and so critical that dealing with those emotions also becomes challenging to us sometimes. The another challenge that we usually face in the child and adolescent psychiatry, and which is very evident, that adult जो है, जैसे आप और मैं हैं, अगर हमें कोई तकलीफ है, अगर कोई इमोशनल इश्यूज है, कोई डिफिकल्टीज है, तो हम बता सकते हैं. Child cannot verbalize. A 3-year-old can't say that he is having abdominal pain. Or 4-year-old girl can't express that okay, she is irritable because of certain things. So they can only express either through crying. Some children bang their head. Some children throw a lot of temper tantrums. So sometimes वो जो non-verbal communication है वो समझ नहीं पाते parents. And that's why sometimes they end up either hitting the child or punishing the child and criticizing the child. So that is another challenge. So while I am going to interact with a 3-year-old kid, I have to make sure that there has to be a separate techniques to deal with that child. I cannot be just asking, okay, how are you doing? Are you feeling okay? No, the 3-year-old won't be able to tell me anything. So either I have to arrange a play therapy or the environment of a play where the child is playing and doing something. Or if it is suppose it is a 5-year or 6-year-old kid, I have to just ask them to draw some diagram. Either they have to draw a family diagram or they have to do certain kind of a pictorial through which we are able to understand what the child is actually facing the problem. So it is very, very important that in the child and adolescent psychiatry you should be very well trained, and this is another challenge. That's why I tell you training is important. Not all the people are trained in this. Dealing with adults is different, dealing with the children is different. So these are certain ground level difficulties which we face day in and day out when we deal with especially these children, and that to us specially able children. So you can just understand the difficulty. यहाँ पे normal children को interact करने में इतना difficulty होता है, तो specially able children को interact करना is a huge task. And the most important for, I can say about me or from my colleagues also, time. It's become absolutely difficult because one child case, if I have to understand, it requires 1 hour. And in a busy OPD where I cannot give more than 5 to 7 minutes to per patient, giving 1.5 hour to one child becomes difficult. That's why sometimes we have to keep a special day only for the child and adolescent cases where we can dedicate that time to them. So actually it is a very time consuming process, and that's the reason why very few people actually get into the child and adolescent psychiatry, because it is time consuming, because it's not only the child, I have to deal with the entire environment of the child, which includes the family, which includes grandparents. Sometimes there's a lot of tussle happens between parents and grandparents, because grandparents wants to overprotect the child, उसके लाड करने हैं, उसके सब लाड जो भी उसके डिमांड्स है वो पूरी करनी है, and parents don't want that. So many of the time अगर आपने ये सुना होगा कि grandchildren के friends grandparents होते हैं, parents उनके लिए villain होते हैं. So sometimes making grandparents understand that okay, the way you are handling your child, you are actually not helping the child, you are spoiling the child. That becomes another task. So and the another important thing is another environment of a child is a school. So I have to even interact with the school teacher and school principal, make them understand what the child is going through and what you are supposed to do. Certain is something called as school level modifications are required for certain children. So suppose some children is an anxious kid. So I have to tell the principal, okay, initially you have to go very slow with the child. Just don't make the child stand up and ask in front of the entire class some question. First you build up the confidence in it and slowly go with the processes. If the child is a hyperactive child, so then I have to make a particular appeal to the parents or to the principals, or maybe for that matter the class teacher, that make that child sit in front, don't rotate their places. So these are certain modifications which are required, where I require a lot of cooperation from the school also. So these are the certain things, certain ground level difficulties which we face when it comes to child and adolescent psychiatry.
Just now you tell all those things, all the difficulties, but could you elaborate the actual technique, like how do you identify the problem? Or
yeah, that's a good question. Actually, the first important thing for us, for me as a clinical practitioner, is that first I need to have a thorough detailed history. Means I have to take exactly a detailed information about the child, right from the birth till the current age. Means how the child was born, whether it was normal delivery, whether it was a cesarean section, why the C-section was done after the delivery, whether the child was having normal outcome or whether the child was kept in NICU, child has any medical issues during that time, how the child was developing, whether the child was developing normally or whether the child has a developmental delay. So I have to take a thorough history till the current age group. So that is the first thing. The second thing is about obviously the examination. So where I have to do, whether I have to find out whether the child is having any neurological problems. So that I have to find out. After that comes, there are various tests that we do depending upon the age of the child. So if the child is too young, then we cannot actually subject the child to any test. But if the child is, let's say, around 7 and 8 years old, and we have a DAP, that is draw a person test, then we have asked them to draw a family diagram, then we ask them to draw their thought process tree diagram. So lots of those techniques which we use. Then there are certain, if the child is an adolescent, let's say 13, 14, then there are certain psychological tests, something called as a TAT, that is thematic or perception test, or CAT, that is child or perception test. So we apply those tests. Those tests reflects the emotions and the behavioral difficulties of that child. So let's say for particular thing, the child is having some behavioral problems, especially only in the home environment. But when the child goes out, child is all good. So I have to find out through that test. So this test tells me, okay, if there are any problem in the family environment, child may not be telling you directly, but the child is expressing his feelings through that particular picture. See, I mean, child may show, okay, there are certain tussles happening between father and mother, and because of that the child is getting affected. The child will show that, okay, mom, dad is fighting and the child is crying outside. So these are the ways, these are the techniques that through which we have to identify. The another thing is that we do usually to rule out if there are any neurodevelopmental problems. So we send the child for scan. We do the EEG test, which is the test which is recommended in the children, because certain children who have the problem of fits, which are not fit. So for those children, we need to do something called as a EEG test. And then there is something called as diagnostic formulation, which is one of the things which is very important in child and adolescent psychiatry, where I have to find out कि पहले तो ये चाइल्ड में जो प्रॉब्लम हुए इसका रीज़न क्या है, जो प्रॉब्लम हुए हैं वो कंटिन्यू क्यों चल रहे हैं. सो प्रीडिस्पोजिंग फैक्टर्स, precipitating factors, and then I have to find out what are the protective factors, means what are the modification that I can do in the child or maybe the child's environment, that I have to find out. So that is the way. So these are techniques. There is no single technique. I mean, this is not like that ki I have let's say malaria and I send the malaria parasite test. So there is no single test. We have to decide the techniques depending upon what are the child's problem is. But in short, yes, clinical examination, clinical history, certain screening test, like in autism we have a screening test called ISAA. Then we have ADHD ke liye there is something called the Connors rating scale, which is the scale which is given to parents as well as the teacher. So both of them, they fill those tests, and then that gives us idea, okay, whether the child is really hyperactive or whether the child having attention deficit. So all these tests, which are screening tests, are available, which we use during our interviews. So that's how the entirely different techniques which we try for helping those children, so that we can diagnose them early and we can intervene early.
Okay. What is your advice to family, their siblings, parents, or society in general?
Okay, one very beautiful sentence which always my mentor used to say, that every child is gifted. They unwrap their talent at different times. That's the only difference. I always keep on telling parents that don't even compare your child with any other child. Every child is born with something. They have the certain abilities which may not be there in other children. So please look at those abilities and quality and try to develop them. If your child is intellectually challenged and not able to do good in the academic skills, find out what are the skills your child has which you can develop. So first important thing, stop comparing. Start enhancing their skills. Another thing, please get the stigma out of your mind. Please destigmatize these mental health challenges. Please work on it. That's my important message to the society. The third important thing is, it is in the child and the adolescent problems, it is more of a family and the parents, they get involved and they have a lot of expressed emotions. So it is very important from my side, the parents should take care of their own emotions also. Because of the children's issue, the parents have anxiety. Sometimes the parents, I am treating child and as well as in some cases I am treating parents also for depression and anxiety. Because they are so anxious, they become absolutely blank and they feel that, okay, boss, my child is having autism, now it's going to be a mess for entire my life. How I am going to tackle with this challenge? My child is going to be dependent on us. What will happen after we go from the child's protective environment? So obviously I understand these questions are valid, but then still we have to find out the certain solutions to it. It is then problem based focused, or I can say problem focused solution which we need to find out. Because the society and enlarged, yeah, definitely it is very important, because in such cases a lot of support is required. So be supportive to each other, whether it is grandparents or whether it is parents. And if your child is facing some problem, first of all accept that there is a problem. If you keep on denying it and if you keep on delaying it, you are actually losing on to the important treatment period. In our terminology, there is something called as a sensitive period. So from the age of 2 to the age of 7 years, it is considered as a sensitive period. If your child is having any developmental issues and if you don't deal with them in this particular period, you are losing the major chance of improvement. So detect early, and if you get detected, please consult early and start the early treatment. That's my message to the entire society or family at large, so that you can help that child build their strength and live a near normal life, so that ultimately we can provide some quality of life to them. Because if they are born with something, some difficulties, it is not their fault. But yes, we can still develop certain things in them so that we can make them independent in their life. So that's all from my side. Thank you.
Thank you so much, sir, from your busy schedule. like you gave us this
No, it's
time.
my pleasure. It's my pleasure because it is one of the very specifically it is close to my heart, this topic, because when it comes to child and adolescent, I feel that is very important because they are the future of our country, and if we can strengthen them well, we ultimately end up strengthening our country. So thank you.
Everyone, myself Rajan Mistry. मेरा यहाँ आने का एक जो रीज़न था that was because of my mother. She is suffering from schizophrenia. हमें इस बीमारी के बारे में पहले तो कुछ पता नहीं था, बट जब हम यहाँ पे आके भूषण पाटिल सर से मिले तब डिटेल में हमें पता चला कि ये ऐसे भी कुछ बीमारी होती है। और जिस तरीके से मेरी मदर को यहाँ पे ट्रीट किया गया, इट वाज बियॉन्ड माय एक्सपेक्टेशन, टू बी वेरी ऑनेस्ट। काफ़ी अच्छी तरीके से उनकी देखभाल की गई। यहाँ पे मेरा आने का पर्पस दूसरा एक ये था कि मुझे यहाँ से कोई मेरे दोस्त से यहाँ के बारे में काफ़ी कुछ पता चला, रिव्यू काफ़ी अच्छे मिले, तब जाके मैंने यहाँ इस हॉस्पिटल चुनने की आई टुक दैट डिसीजन टू कम ओवर हियर एंड finally it was a great decision because I can see the result. मेरी मदर को काफ़ी अच्छे से यहाँ पे ट्रीट किया गया. Now she has recovered almost 70-80% from where she was admitted here, and I wish all the best to भूषण पाटिल sir. और मैं ये भगवान से प्रार्थना करूँगा कि ऐसी कोई बीमारी किसी और को ना हो, किसी को यहाँ पे आने की ज़रूरत ना पड़े, बट अगर किसी को आना भी पड़ा तो वो जल्द से जल्द यहाँ पे रिकवर होगी। ये तो मेरी डेफिनेटली ये आई एम वेरी मच कॉन्फिडेंट अबाउट दिस द वे भूषण पाटिल सर हैज़ हैंडल्ड द केस. सो थैंक यू वेरी मच.